Yes, what happened? Reinforcing and reducing manipulation by the twirling and rotating the needle. So how does it happen? So normally there are the few procedures. Generally you can do it, and please come, somebody volunteer can sit next to me to take up some reinforcing method without paying anything to me, by the way. Right. Who wanted to come? Option is near. Dismiss it. Yeah, let me see, because whenever I'll talk about the tonify the points or the sedate the points, always you should have in your mind. So I just use as a 40 needle. So tell me any one point. Huh? But that's the necessary point, that you cannot be considered as a tonify or sedate. But you should say the command points. Sorry?
LI11.
Yeah, LI11 is a super simple point, you told that. But by the way, just I'll try to show you where the day-to-day clinical practice we normally use this point. But how P6 you cannot do much that, because it is the next Luo connecting point. No, you cannot do like that. But now I just use rather than that P7. So we'll think about the pericardium 7 point later after finishing this point. Now I just use the 40 needle here. Just I wanted to tonify the point that's called as LI11. So where exactly the point is located? LI11 point is located, this is the lateral end of the cubital crease. Lateral end of the cubital crease and lateral epicondyle of the humerus. Midway between these two, the point is located, that to be known as a Chu-Chi. Right? You try to find out. This is different. This is different and this is different. Right? When you touch this, this is the olecranon process of the ulna. You touch this on the lateral side of the bone, that bone to be known as a lateral epicondyle of the humerus. This called as a lateral epicondyle of the humerus. This is called as a lateral end of the cubital crease. Midway between these two, that point to be known as a LI11. So I just apply this point towards the tonification, towards the energy flow. I just apply here LI11. Now this slowly you enter. Yes, this should goes to the upward direction. This should goes to the upward direction. So in this way you can do it, that always is good. This is a simple tonification. So you wanted to do further, it is the rotation, twirling method and twisting method. Then you just apply like this and do this is the twirling and then twisting and twirling and twisting method. In this way you can do it, we can do it. And the flickering method, this also is the activation method. You just apply this. Then lifting and then thrusting. Lifting and then thrusting. This also we can do it for the tonification method. When you wanted to apply this direction, okay, then again you just make sure he is comfortable. By the way, his needle is like this, but no much pain. But whether the patient says lie or the truth, I need not to ask him. But the needle talk to me and that tells me there is no much pain. Right? So now there is doesn't have much pain. In that indicating this is as a tonification. Now the same point I wanted to do sedation. What condition need to be tonified? What condition need to be sedate? You remember there is a colon. The colon having the low energy. When there is a problem is this point is always is good. When there is a diarrhea, when there is a dysentery, so that time you just increase the energy level. When dysentery, diarrhea, you just slightly increase the energy level. So when there is a constipation, that time you just decrease the energy, because it is a more retention is there, accumulation is there energy, so that you need to decrease that. Don't take the needle outward and then inside. You just take the needle, then just from inside only, you just change the angle region, then you just do it this sedation. This is good. to sedate the large intestine energy. Make sure this energy towards the large intestine. The pathway of the energy should be on the large intestine level. That always is good to reduce or deplete the energy or the decrease the energy. Now see the importance of this point. This is as a mother point of the large intestine. This is the mother point of the large intestine, is indicating that is strengthening the energy to the large intestine itself. But at the same time, the being a mother point, I sedated again. When I sedated this point, the large intestine energy sedated anti-direction of the energy flow, that indicating that some of the conditions we need to do it. For instance, because of the constipation, because of the pushing the stool, and the patient having the loose stools related to the bleeding also is happening, then you remember there is a hemorrhoids, internal hemorrhoids, partially external hemorrhoids. That condition you need to sedate the same point, decrease the energy, because this point belongs to the humidity point. This belongs to this is the earth point. That means the large intestine is the metal point, but this point's property is the earth point, that indicating Li11 is equivalent to the stomach 45, that is the Lidoi. Therefore, stomach heat also get decreases, large intestine heat also get decreases, because the stomach and intestine together is causing the problem is hemorrhoids. And due to that reason, you just decrease this energy, then the humidity will come down, then the wind, that's called as a dampness, will come down. That time the stool which is passing as either it is related to the bleeding is happening in the internal piles, that time also it comes naturally, slowly it will come down. This called as a sedation. But now how to withdrawal of the needle, and also how many minutes the retention of the needle. But the retention to be taken place, minimum is required is the 10 minutes is required, maximum is required nearly 28 minutes to 28 seconds, that is required, but may not be that much time is required. But however, 10 minutes you just apply the needle, then you just withdraw, that's quite enough. Number one is the sun points. Whether you wanted to use as a mother points you are using, that time it's advisable you can keep it minimum 20 minutes you can place the needle, that's quite enough. Hopefully you are understanding. When there is a tonification sedation to be taken place, when you wanted to sedate, you can place only the 10 minutes are advisable. When you wanted to tonify that, so that time you can place it around 20 minutes to maximum 28 to 30 minutes is good. But however, it's not totally mandatory to place. But for the patient's gratification and satisfaction, because acupuncture having the acu, that's called as a acu nap. Acu nap, power nap normally we say in the afternoon. There is another name called as a acu nap is taking place by the patients. Whenever you apply the needle, there is an endorphin releases in the body system and the patient sleeps very well. That indicating that's called as a acu nap. He is taking the acu nap. That time don't disturb for him for at least 30 minutes. Then further there is a problem is here as a 10 to 15 minutes you place sun points. Even according to my clinical experience, you wanted to use as a sun points, insert the needle and you feel that kind of the sensation, then withdraw immediately. That also quite enough if you are using the sun points. When you wanted to tonify, you just apply 10 minutes to 30 minutes is advisable, because you open the tap, easy it flows. When you wanted to ascend to the drum, water need to go to the upward direction to the building, then it is coming down. Going is ascending to be known as a tonification, descending to be known as a sedation. Descending it takes very lesser time, ascending it takes the longer time. That's the reason it's advisable. That's the reason it's advisable to be sedation to be taken place same point. Mother point also you can tonify at the same time sedate. Grandmother point also you can tonify at the same time you sedate. The sun point also you can sedate at the same time you can tonify. How the cycle, the human system, for example, the man is around 70 years, you keep it in the mind, 60 years old man. Then he has taken the children for them, the beginning At the age of the birth, till 30, 40 years, the survival has been given to the children. Then after 40 years, after 40 years of the child having the liberty, child having the, he need to take care of the parents. But the parent is 70 years old. The parents need not to take care of the children, but children need to take care of the parent. That formula need to be implemented for the 5-element cycle. Not the only one direction. Some authors disagree on it. No, I conquer this. Some people, they don't conquer that. The energy goes in the opposite direction, that the person will going to die. But I don't agree on it. But however, tonification or sedation, but however, with the intention it works, and also the different direction of the energy, how you are going to do that based on that perspective works. But now I just apply as a sedation, you withdraw the needle quickly, or you wanted to tonify, slowly withdraw the needle. Now already I sedated this. How to this sedate? Just I wanted to pull the needle rapidly. I just now pull the needle rapidly. Please come somebody and pull the needle rapidly. That's in that way that we are going to sedate that energy. Don't close the hole. Don't close the hole. Withdraw quickly. Good. So let me see. This is the benign complication. If the bleeding happen 1 or 2 drops, you need not to worry. If the bleeding happen, that is a benign. Don't close it, that hole. After some time that will get subsided. Make sure when the bleeding patient shouldn't see in front of him. That means when the bleeding is happen, that time if they know that bleeding may happen, then it's okay. The patient doesn't know bleeding is happening, that the controversy will happen. Maybe sir, after the incision of the needle, maybe the bleeding is happen in my body. That is really the dangerous way the people inserted. Maybe the interns or the trainers or maybe other people or myself. So once we do the insertion, their knowledge is not there, but that time they feel very bad that we have damaged our blood vessels, damaged our skin, damaged our body system. They feel in that way. So sometimes this happen. Maybe one lady told me that I just applied the Pai Hui point for the psychosomatic disorder. That is a schizophrenia patient. So that time I just applied the Pai Hui and then Si Shen Chung. Si Shen Chung is extra 4 point. So after removal, I don't remove the needle by the way. Then she gone to home and the evening, morning we just applied. Evening she called me at 8 o'clock, doctor. So what happened? So it is the bleeding is oozed out on my head. So what will going to happen to my head? Already I am suffering for this problem and somebody made like this, bleeding is happening. This is the complication. What I should do? The seriousness, the way she told me, really astonishing me that why does it happen? This is not good. That's the reason I tell strongly to my staff, whenever bleeding is happen, but I'll tell them, I do bleed this point. I'll tell because lancet already is there. I just use the lancet and then I bleed purposely. Now I told you, SI1 Shauza, you just bleed. I told you. But you just convey this message before doing the procedure to the patient. Without that you do it, but that is really wrong. You know that this point will get the vasovagal tone. Maybe some kind of the shaking happen, some electricity can be happened in your body. Tell and then apply. Later they recognize. Then I say, this is quite enough for you. Ouch. They feel happy that without telling them it happened. Oh, something is happened bad. In that way, they will take it to their mind. That's the reason we should be very, very careful. Either it is a tonification or sedation, but be careful and then apply anti-direction of the energy flow. You just apply for the sedation and then withdraw the quickly needle is advisable. Not required strong stimulation for the sedative points. At the same time, you wanted to tonify, strongly vibrate the point. So now you are in dilemma, sir, I am not sure that whether I need to tonify or I need to sedate, I don't know. But I know that point need to be activated. You are activating that point. But that time what is required, for example, I'll show you one point, Shao Sanli. That is the general point I'll tell you. But this point to be activated, use this Li, This again 40 mm needle I just inserted. After the insertion, you just activate like this. One is the rotation, tonification, and then sedation. Tonification, sedation. Body works according to the biomagnetic, biofeedback mechanism. So therefore, you need not to worry whether tonify or the sedate. But still, when you go to the higher classes, as the time bound sensitivity understanding, so that time it is required either you need to tonify or need to be sedated. In this way, this is as a LI10 point. So you just do like this as a stimulation clockwise and then anti-clockwise, and then you just apply the pressure and then withdraw the needle and let the hole shouldn't be open again, right? So in this way, you just do it as a tonification and sedation. Anyone having the doubt regarding this right now? Yes, please be seated. By the way, for you, this one chocolate. You should